Okay, everybody, last video for this part of mine in the Unit 1 folder. A lot of information, I realize and understand, lots of articles, but I'm going to try to help you out as much as possible when it comes to looking at some of these articles on the teaching and learning concept, and you'll see them in your computer as such. So let's share the screen and let's look at the module, teaching and learning concept, and that's what you'll see it listed under on YouTube in the folder and all. So teaching and learning. So as you become a new registered nurse, you're going to see folks that you're going to be around, be assigned to someone in capstone, possibly could end up being your mentor later on, but then you're going to have someone that you're going to be, that's going to be your preceptor. So that's a little bit about what we're going to discuss and the roles that nurses, registered nurses, will have in staff development with the unlicensed assistive personnel, the UAP. You'll see it abbreviated as such, and describe the attributes that the mentor will have. I still have folks that I worked with, got me started years ago, that I'm friends with and still go back to them and reflect on things and ask questions about. And that's been 33 years ago now. So developing relationships with your preceptor, letting that person know what you need and deciding on how to figure it out. So the first thing I want you to do is to go to this North Carolina Board of Nursing website. Familiarize yourself with it, because then when it's time to renew your license, that's where you'll go. When it's time to get your license, that's where you'll go. There's lots of good information here on the North Carolina Board of Nursing, but the thing that I want you to concentrate on is this position statement for RN and LPN practice. And we're going to look at the bottom of the screen where it says nurses section. Select decision tree for delegation to the UAP, the unlicensed assisted personnel, and the scope of practice decision tree for an RN and an LPN, because you're going to learn delegation, and this is the one way. 3 articles. This one I'm going to put in your Unit 1 folder, and these 2 you're going to look up and open the link and print them off and read them. Remember, they're not an optional read. So we'll stop sharing this screen, and then we're going to go to another screen, and we're going to look at one of the decision trees. So you'll know what it looks like when you go to that particular State Board of Nursing website. Scope of practice decision tree for the RN and the LPN. So you as the RPN, you as the RN are going to have folks working in your team, your group, and this person they're licensed, but they're not the registered nurse who is in control, who has the say-so. And it's a teamwork approach. So define, identify, and describe and clarify the activity or the task between the 2 of you. What can you tell or delegate to this person, to the CNA, to the LPN, to anyone else on the floor, to the monitor watcher, techs and things like that you're working with. So is the activity prohibited by the State Board of Nursing or the Nursing Practice Act, board rules, statements, or by any other law, rule, or policy? So yes or no. If it is yes, then you stop there. They can't do it. You have to do it. So delegation is knowing what you can do, allowed to do, and also knowing what other people can and cannot do. So the answer on this one, if you'll follow along, here it says no. So we go down to this block where the arrow leads. Would a reasonable, prudent nurse perform this activity in the setting? No. Stop. Don't give anybody else an activity or something to do that you wouldn't do yourself. That's what that means. Stop. No. So would a reasonable, prudent nurse perform this activity in the setting? If it says yes, does the agency have a policy and procedure in place allowing the activity? Yes or no? If the answer is no, You don't go any further. If there's not a policy and procedure for you yourself as the registered nurse, you stop right there. And you get your nursing supervisor or your charge nurse or your nurse manager, not specifically in those orders, charge nurse, nurse manager, then the nursing supervisor, and then there needs to be something that will protect you and keep you safe and the patient that you are taking care of safe. So if there is a policy and procedure, has the RN you're delegating to or the LPN had education or documentation of competency in performing this activity? Yes or no? If no, the answer is stop. Complete the education and document it. Education in the department can come over, not necessarily that day, but in the future. But if it says yes, is the nurse prepared to accept responsibility for managing outcomes and consequences of the actions? You as the registered nurse, team leader, person in charge, person who these are your patients and everybody else is working with you, but you ultimately are responsible. If the nurse is prepared to accept responsibility for managing outcomes and consequences of the action, yes, is the RN or the LPN to follow the RN lead and or follow the LPN lead. If no, what do we say? Stop, don't do it. So this is how that scope of practice delegation tree works. So you're going to have an activity here in the future on LMS in the forum that is going to ask you some questions, and it's going to ask you how you are going to handle the situation. And you will see this information on your test. So I suggest to you to print this material off and keep it in your folder, take your notes on it, look at it, study it. So don't just ignore it. It's not an option thing. You need to know it. So enough said about that. So we're going to share the screen again, and then we're going to go to the module, not the module, the PowerPoint, and we're going to get this one done. So we're going to do the slideshow. Come on, computer. And we're going to talk about teaching and learning. There's different ways teaching and learning. We all have our style of learning. I think I just shared the student copy. So let me get McHargue's copy up because that has my notes on it. So when we talk about teaching and learning, different style of methods of style, boy, it's late. So how do you learn best? How does your patient learn best? How do you teach best? Is it reading something to somebody? Is it watching a video or giving someone a video to watch? Is it giving it a pamphlet of information and talking about it? Or are you just sitting down discussing it? So you saw your objectives about teaching and learning on the module. So here, let's talk about what else we're going to discuss in teaching and learning. Who can you teach and what do you teach? So think about the folks that you're going to be working with. So you are going to be working as a registered nurse. It is your group of patients. You're responsible for those patients. Are you willing to accept the responsibility of others' actions that you pulled in your boat and you ask them to do something for you? If you're not, don't ask. Do it yourself. But know how to delegate. We're going to learn that in Capstone. We're going to learn that throughout the semester. And we're going to realize and understand that we can delegate certain things to certain people. And then again, you got to be careful what you delegate. So go to that North Carolina Board of Nursing, NCBON, it's on your module, and look up that decision tree. Can a preceptor teach a new nurse? If that preceptor has experience and is knowledgeable, then yes. How many years of experience do you need to be able to teach a new nurse? State Board of Nursing says at least 1 year. So when you are working with a preceptor in capstone, it's a conversation the two of you need to have, a list of things you need to develop. What do you need to learn before you graduate? What is there something that I haven't done? Have I put in Foley's on male and female? Have I started IVs? Have I started drips? Have I called the physician? Have I called the healthcare provider? Do I need to talk to pharmacy? Do I need to work on communication? Lots of different things. So know what you need to learn. So yes, a preceptor can teach a new nurse. Can a new nurse teach a seasoned nurse? Absolutely. Technology changes, upgrades. So there are different things that a new nurse can teach a seasoned nurse. Things change. And we've all seen that in the last year. So definitely, just because you know how to do something does not mean that it is the right way to do something. There's many ways, and I'm sure that some of you have heard this saying, many ways to skin a cat, skin a possum, however you want to say it. But if we work together to get to a common goal or a common way of what's safe, then we can get it done. Teamwork, I say, is the best. Orientation is going to roll around when after you graduated, passed your boards, got your license, you're going to be excited. So orientation has changed from what it used to be. Now I believe that you get 12 weeks, and if you're in a specialty area, you get longer. Some get 16 weeks, some get a year, OB or used to be. So orientation is a period of introduction to the philosophy, the mission, the vision, the goals, the policies, the procedures, your role in position expectations, physical facilities and resources, patient populations. Some of you could go to telemetry. Some of you could go to the oncology renal floors. Some of you could go to the OR, some critical care. So it is a period of introduction to that particular area, how the practices are set up, what the policies are. And you're going to have a preceptor for that amount of time. And the preceptors are going to let you do certain things, and then they're eventually going to just be there for you, just as I call it, your angel wings, so you can practice. Roles and responsibilities will change. What happens in orientation? We said a few things about that just a second ago. You start your new job as a registered nurse. Can you imagine? So exciting. You go to a general hospital orientation, you go to a specialty area orientation, you're assigned a preceptor, and you begin a career. And in your assigned department. Now, I don't know all facilities, but some facilities will say you can't move from 2 North off telemetry or wherever you start until you spend at least 6 months there to know if this is really for you or not. But in the interim of that 6 months, if you just can't do it, then you need to speak up and talk to somebody. Do you think orientation could be overwhelming? You should be nodding your head. Absolutely. Starting a new job is overwhelming. Working night shift and adjusting your life to night shift, especially if you have a family or you have children or a significant other. And just being single night shift, I think is hard. I worked the first 7 years of my career on night shift. We were working days, 8 hours, and night, 8 hours, flip-flopping week after week. That was hard. Then we went to 12 hours. You either did days 12 hours or you did nights 12 hours. So I went to nights, done all kinds of shifts, and adjusting to the new norm. Should you ask questions? What did Ms. McHargue say earlier about asking questions? Yes, you should. Absolutely is Ms. McHargue's answer. Never be afraid to ask a question. Should I speak up if I see something happening that shouldn't be happening? If somebody's not safe, if the care being provided for this person is not what needs to be provided? Absolutely. Because if you are the nurse taking care of a group of patients and you have an LPN underneath you and you have a CNA underneath you, you are responsible for all 4, 5, 6 of those patients and what these other people are doing. Can I learn something new every day? You had better, or of course you should, because when you open yourself up to learning something new, then you are a continual learner. You don't shut yourself off. Do you know everything? I hope that your answer to that is no. So preceptor acclimates you, the new nurse, to their new environment, to your roles, provides the new nurse with guidance. The relationship becomes a formal one, a one-to-one relationship of predetermined length. You already know what time length you'll have when you start your orientation. Between an experienced nurse, preceptor, and a novice nurse, the preceptee, does it designed to assist the novice in successfully adjusting to and performing the new role. Is it going to be like having a faculty member over your shoulder looking at your every move? No, will not. But your preceptor is going to want to know, are you capable of doing the skills, the tasks, the things that you need to do to safely take care of your clients? Preceptors will introduce you to other people, to physicians, to healthcare providers, to nurse practitioners, to pharmacists, so on and so forth. You'll discuss your roles and your responsibilities. They will coach you in what the basic things to do, like where should I park? You'll get that in general orientation. When should I be here to give report? Where to find supplies and resources, the codes to the code rooms, the crash carts, where are they located? Where is a piece of equipment that you might need, depending on what floor? So this is what different things your preceptor is going to help you with. Also, when you have your preceptor, they're going to help you, support you, and shape you into a seasoned nurse. A novice, yes, but they'll help you with critical thinking skills. It's always good to bounce something off or question. Say, would you do it this way? Or how would you do it? Can I watch you once to see how you do it? But you need to get your hands, as I've heard many people say, into the cake and design and make it. They're going to help you evaluate your performance and to give you feedback and help you improve. You also, the novice nurse, the preceptee, are going to tell the preceptor what you need. So the roles of the preceptor, we talked about those just a little bit. Help develop unit-specific competencies. How do I get my BLS done? When do I go get my skills checked off? What time of the month do they do skills check off? Do I need to do ACLS if I'm working on 2 North? Initial competency verification of knowledge, skills, and abilities. Do I know how to read rhythm strips? Do I need to take a basic EKG class, which education can provide you? If you're on 3 North at Ardell and you have pediatrics, do you need to take pediatric advanced life support, PALS? Sure, it helps you gain knowledge of what you're going to be doing and whom you're going to be taking care of. They're going to help you evaluate your progress. You get to the end of that orientation and you're like, I just don't know if I can do all this, or I may have a few things I haven't done yet that I need to do. Then you need to speak up. They're also going to help provide feedback to improve your knowledge and your skills. And the formal precepting relationship ends with the completion of orientation, although this relationship can continue, because if you have a good preceptor, you're going to feel comfortable going to that preceptor and asking questions. Teamwork, vital. I will tell you, when you think you can do everything by yourself, Ms. McHargue is going to say, no can do. I've got working on 2 North. I'm speaking of Ardell. Working on 2 North on telemetry, fast-paced floor, turnover goes quickly. I've got 6 patients. I got 3 discharges, and I'm going to get 3 admissions. You need some help. It's okay. Interdisciplinary teamwork is an important model for delivering healthcare to patients. Remember that boat we talked about earlier? We have interdisciplinary teamwork. We have PT on 5 North and any other floor, OT, and we have pharmacy, we have all modalities of interdisciplinary teamwork. Enhancing communication. You got to learn to communicate. You got to learn to tell people you don't got to anything. You need to learn, you have to learn communication. If you don't speak up for yourself, nobody else is going to. In a complex and specialized environment, teamwork is imperative to ensure patients' well-being, safety. They're being taken care of the way that they need to. Imagine yourself working in a busy ER or in a critical care unit. You guys, we're going to see a lot happen this semester, and just keep going, moving forward. Working together helps reduce medical errors and increases patient safety. Key to that phrase right there, working together helps reduce medical errors and increases patient safety. That's imperative. It reduces the risk, and it can, if you don't have teamwork, it can lead to burnout. You will experience burnout at some point in your career. It's going to happen. Just know that there's people there to help you. Mentor is a voluntary, mutual, beneficial, and usually long-term professional relationship. In this relationship, one person is an experienced and knowledgeable leader, a mentor, who supports the maturity of a less experienced person, the mentee. I'm going to tell you a personal story. When I was in nursing school, you know that I worked weekends. Wonderful nurse, you may know her. She's a family nurse practitioner, has been in practice for some time, Melody Moore. She took me under her wings, loved to teach. And during the time that I was in critical care, she would constantly ask me things that I wanted to do, things that I wanted to do when I got out of nursing school, where I wanted to work. And once she understood that I wanted to work in critical care, she took me under her wing and she said, okay, so let's do some things. Back then, there was no registry for certified nursing assistant. And you didn't have to be a certified nursing assistant with State Board of Nursing, but now you do. But I still had that ability because of nursing school and some other things to do CNA things, as well as being the secretary, the ward clerk in the critical care. So she said, okay, from now on out, you wear your scrubs. And when you're not busy doing orders and things, which there was no computers then, telling my age, we'll go and you can help me change dressings and empty Foley's and learn different things, calculate eyes and nose and different things like that. Wonderful experience. I don't know if any of you guys know Dr. Paul Kirkman, who used to be a cardiologist in Statesville. He's now at Baptist. I don't know if he's retired. He probably is by now, but he also learned that I was interested in cardiac. So the two of us that got to start in critical care that year, he took us both under his wing and taught us different things about Swan-Ganz catheters, arterial lines, cardiac rhythms, ACLS, and different things like that. I could not have asked for better mentors, and I'm grateful that I had them. So look and know what kind of mentor that you want to have. These mentors are going to be your coaches. They're going to be your advisors, your friends, your cheerleaders to keep you going, and your counselors to help you when you have questions or something just doesn't work right, or you reach that burnout point. Just know that nurses will at some point. A mentoring relationship is built on trust. It is confidential. What that person, your mentor, tells you, that's personal information, confidential information between the two of you, and you should be able to trust that person not to share. So again, know what type of mentor you will look for, as well as preceptor. So roles of mentor, advisor, role model. They should role model the activities and things that you need to know, learn, be like them. That should be the person that you see and said, hey, I want to be like that nurse one day when I grow up. They should be your coach, your cheerleader, your problem solver, share thing information with. teacher, supporter, organizing and helping you plan. They should be your counselor and your guide. So successful mentors are trustworthy, they're sincere, and they show mutual respect. And I bet some of you to this day have mentors or can think of people that have been your mentors during your career. They're not in a position of authority over the mentee, they're there for you. They promote an easy give and take relationship and are flexible and open to suggestions and different things. They're able to listen and accept different points of view and to hear what you have to say as well as what they have to say. They have values and goals compatible with those of the mentee and are able to empathize with the mentee's struggles. If you have a mentor on telemetry floor or in critical care or on the oncology floor, the pediatric floor, the women's floor, they're going to empathize with you during your struggles because they've been there. They're nurturing and they have a good sense of humor and enjoy nursing. Preceptors versus mentors. Preceptors are time limited. Mentors are for life, if you're lucky. There's a termination date between you and the preceptor at the end of your orientation. They're assigned to you. Formalized orientation, they assist in fine-tuning those skills to cut you loose and let you do what you're going to do best, and that's to be a competent registered nurse. Their work relation is focused. Mentors are over time, hopefully for life. There's no termination date. They're sought out by you, the mentee. This is the kind of person I want to follow, and I like the way their work ethic is. I want to be like them. They teach networking. They introduce you to others. Share personal experiences and may involve personal, academic, or work-related focus. So, what questions you can send to me in the forum do you have? I will be sending you questions in a discussion forum. So make sure one more time that you look up these articles, you read them, you print them out, you highlight them, and you understand them. Make sure you look at that decision tree from the State Board of Nursing. I promise you, you're going to see that again. And when you do, you're going to say, I'm glad I looked at this. So this is the end of my recordings. Thank goodness. And I will see you guys in the morning, and everything should be posted for you and to get you going. So good luck. If you have questions in the forum, email me, call me, whatever. Just let me know how I can help you. All right.